السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا ونبينا مولانا محمد وعلى آله وصحبه أجمعين. Welcome to Health Matters, a comprehensive chat hosted by the Islamic Medical Association of South Africa. My name is Dr. Shoayb Wadee, and today we will be hosting Dr. Alison Bentley, and our topic will be sleep studies. So it's going to be sleep matters today on Health Matters. As is usual, we're going to start with a tarbiyah and a message from our rich tradition of Sunnah of the Prophet ﷺ. As today's topic is around sleep medicine, I just want to discuss some of the Sunnah and the wisdom around the Sunnah around sleep. As we know, Rasulullah ﷺ was not silent on any matter, and the Quran and the Sunnah give us guidance on a lot of different aspects of our daily lives, and one of those is sleep. And there are many Sunnah and tradition which rotate around sleep. And the wisdom of some of those traditions and Sunnah is becoming evident more and more as time goes past. First of all, we know that in some circumstances it is preferable to stay awake at night and to pray, and we know when Ramadan is coming there will be time for that, and there will be a necessity to do that. So not only is the quantity of sleep important, it may also be the quality of sleep which needs to be looked at, especially during those months when we may sleep very little. So what did Rasulullah teach us? He taught us a few things. The one is that we should prepare ourselves for sleep, and there are certain rituals which we do before we sleep. There's among the Sunnah of Rasulullah was that he used to dust off his bed before he went to sleep to clear it of any foreign matter, make sure there were no insects, make sure there were no creepy crawlies or anything in there. Secondly, there were certain masnoon du'as and ayahs from the Quran which he used to recite. And I'm sure we'll discuss later this concept of sleep hygiene and the ritual and the routine around sleeping, which may promote better sleep. Then the way he used to sleep either on his back or on the right side. And there is some evidence that there's some medical benefits to sleeping, particularly on your sides or in certain circumstances on your back, but particularly on your sides. And then the Quran goes into some depth as to describing some of the stages of sleep and obviously some of the aspects of interpretation of dreams. But there are many aspects around sleep which, if we just look around the Sunnah of what our beloved Rasulullah has taught us, we can get many lessons, and inshallah we can improve our own quality of sleep and do it in a way which will benefit us in this world and in the hereafter. Thanks for that. So our guest today is Dr. Alison Bentley. Welcome, Alison, and thank you for joining us today on Health Matters. As I mentioned, the topic is sleep medicine. So Dr. Bentley is a sleep specialist, or what would we call you?
Well, it's difficult because there isn't a specialty in sleep in South Africa. No, I'm not a sleepyhead. So I'm a general practitioner who has only ever dealt with sleep problems, because they're just really, really interesting, and sleep itself is really quite fascinating.
Right. So Dr. Bentley practices at the Wits Gordon Medical Center in the faculty practice there, and we're going to try and benefit from some of her insights and experience around sleep. Unfortunately, the problem we have tonight is that our phone lines are not working. They're in the process of changing over the technology here at ITV. So we look forward to seeing some improvements in our phone lines over the next few weeks. But that does mean that tonight we don't have phone lines available, which is a real pity. But we'll try and see if we can get some questions that the public out there may have wanted to ask through to you. Let's start at the beginning, right at the very beginning. Maybe it's the end, because the end of the day usually you hit the level where you really need to sleep. What benefit is there of sleep, and what really do we need sleep for, Alison?
Well, it's interesting. I think it's very clear that sleep fulfills a very basic biological function, and we cannot ignore it, and we cannot not have it. You can trim down your sleep. You can get too little sleep because you have, you're working too hard, or you're socializing, or whatever it is.
Yes.
But there comes a point when the brain just will stop and take that sleep.
Right.
And that's really what we look at to say it's an absolute biological function. It's the same as eating and drinking. You cannot not have it.
Right.
And the desire to sleep will pretty much, if it gets pushed far enough, will pretty much take over whatever you're doing. And this is why people fall asleep driving. That's why they fall asleep when they're actually doing activities which could be dangerous if they fell asleep doing
them. So it will overcome that fear and anxiety at some level, no matter how afraid you are of falling asleep. if you deny yourself sleep, or if you reach a level where your brain really needs it, it's just going to switch off.
It's just going to take it. And that's where we get the sense that sleep is absolutely required. Now, you know, within that, there's a kind of sense of, well, there's the right amount that's required and the right quality that's, and it's got to be at the right time of day. And so there's a whole lot of stuff that goes with this right amount, the right sleep.
Yes.
And, you know, whereas it's kind of easy to figure out what the right amount is, although there is some confusion. So very often people will say to me, but isn't the normal amount of sleep 8 hours?
Right.
And no, it's not. The average is 8 hours. And there's a difference between the normal and the average. So the average is that if you take 10,000 people in South Africa and ask them, how long do you sleep for at night? The average is going to be 8 hours. But on either side of that average are people who only sleep 4 hours a night and people who only sleep 9 hours a night.
So there's a distribution.
There is a distribution. And so the normal amount of sleep, so if we kind of, what is the normal for a person? There's a huge range.
Right.
But the normal for you would be the amount of hours of sleep you need to have so that the next day you don't feel sleepy.
Right. So you're going to define the normal amount of sleep as enough for you to function well without the need for without feeling sleepy.
Yes,
basically.
without the feeling that I need to get more sleep than what I had.
So you could be sleeping 8 hours and it could be insufficient for you.
Absolutely. Yes.
You could be sleeping 4 hours and it could be sufficient for you.
Yes. And very often I find that people who come with insomnia will say, well, I can't get to sleep and I'm only sleeping 5 hours a night. And the first question I always ask them, how are you doing on those 5 hours?
Yeah, we've heard that, How do you feel?
How do you feel? If they go, well, actually I feel fine, but there's a sense that I must get more sleep. And I go, no.
Well, I think there's a cultural aspect to it because people expect you to be sleeping certain hours that, you know, if you're waking up at 3 o'clock in the morning, there must be something wrong with you.
Yep.
If you're sleeping at, I don't know, midnight and waking up at 5 o'clock, surely that can't be enough sleep. I think that's a perspective that people have in their lives.
And I mean, I think it's important to understand that short sleeping can go down to 1 or 2 hours a night.
Right.
So I remember very clearly getting a phone call from a lady who said that since she'd been through menopause, her sleep had dropped to 1 hour a night.
Sure.
And I went, wow, that's really quite serious. What was it before you went through menopause? And she said 2 hours a night. And I said, well, how are you functioning during the day? And she goes, I'm fine.
Yes.
So
that's amazing.
It can go down that low.
Yes.
Yeah.
Well, it just goes to show maybe some people sleep while they look like they're awake.
Yeah. Well, I think it's also important that this does not include those people who cut their sleep down to 4 hours a night during the week, because they're going early to work and they're staying up late at night and then get 12 hours on Friday. That's not a short sleeper then.
Yes. I mean, there is this concept that the amount of sleep that you require may change as you age or over your lifespan.
Certainly. Yeah. No, it definitely does.
So how does it vary? Because I think many people are unaware of this, especially older people. And, you know, I've had the experience where some of my older relatives will phone me very early in the morning because that's fine. They've had enough sleep for the day and I'm still a teenager.
Yes. No, I think it is. And our sleep does change during our lifetime. And I think and you raise an interesting point because the brain doesn't send you an SMS to go, hey, by the way, I've dropped down. I don't need 7 hours anymore.
Sleep, yes.
And so we do get into a habit of bedtime and wake up time. And we kind of keep those quite rigid. So very often bedtime is 10 and wake up is 6, and we just keep those. Well,
especially as you get older, you tend to thrive with routine.
Yes, so but not only that, you get told that makes your sleep better.
Yes,
so pick a regular bedtime and a regular wake up time. Right. Now that's great if you need 8 hours of sleep.
Right.
But as we get older, the amount of sleep does decrease.
Right.
And if you need 7 hours, the way the sum works is you're going to spend an hour awake.
Right.
Okay.
Absolutely. Yeah.
And that's either an hour trying to fall asleep,
or an hour in the morning,
it's an hour in the middle of the night, or it's an hour in the morning.
Right.
And so the perception often is that that's a sleep problem now.
Yes.
Whereas if you actually just went, instead of 10 to 6, decide which one you want to compromise, right? I would always go 12 to 6 because I'm not an early morning person. But some people would say I'd rather wake up at 5. If you did that and cut it down to 7 hours, you would find that your sleep was fine, that it was stable and it was complete and
you feel fine.
A solid block and you feel fine,
It's the matter of matching your expectations with the reality that your physiology is.
Well, we talk about
changed.
a sleep need and a sleep opportunity. Okay,
Right.
so you give yourself a sleep opportunity by going to bed at this time and waking up at that time.
Right.
If the opportunity is 10 hours, but the need is only 7,
there's a mismatch.
there's
there.
a mismatch
Right.
between the two.
Similarly, if the opportunity is 5 hours, if you're an intern at Barra, for example, and the need is 8 hours, there's a mismatch there.
There's a mismatch, and you're going to have sleep deprivation.
Yes,
now, that we wouldn't necessarily call insomnia.
Right.
Okay.
Yes, sure.
So insomnia occurs when there's a mismatch between the need and the opportunity, but it's self-driven in a sense. So it's an environmental cause that impacts on your sleep.
So the opportunity is reduced by some environmental cause,
yes.
maybe too much light.
Yeah,
we'll go through some.
Yeah,
of
we
those
couldn't.
things.
We wouldn't call that an insomnia. The insomnia is where you have enough opportunity.
Yes, but
you just can't get.
Sleep.
Yeah, you can't get the.
And then
amount
obviously
that
becomes problematic or pathological when it impacts on your life.
Yep.
When you feel tired, when you feel lethargic, and
well, that's the definition of insomnia, is that you get insufficient sleep for your daily function.
Yes, absolutely.
Yeah, so there's a mismatch there.
If you had to look at the quantity of sleep that a baby has, usually it's tremendous, the amount of sleep that
14,
a baby will
15
have.
hours.
And as you get older, generally the amount of sleep reduces. Would you say there's a linear relationship and people can predict how much sleep they would need, or would you say people will have to see how it is as they age?
Yeah, I don't think it's linear. I think so it drops from 14 hours a day to about 10 hours in about 2 years.
Sure.
Okay,
right.
so that in that first 2 years. Then from 2 years up until about the teenager years, it drops from 10 to about 8 years, 8 hours. Then stays at about 8 hours for quite a long period of time. I find that it's around 45, 50 that it drops again. And then it's completely illogical as to when it drops. And I think part of the reason is because some people have a very good sleep habit. They can go to sleep even if they're not sleepy.
Sure.
You know? And so they tend to stick with 8 hours, even though the brain might have dropped to 7. They're still able to get that extra hour.
They're able to make themselves
But
sleep.
very often if they have a reason for insomnia, so some kind of stressful experience that they have, they suddenly drop down to the minimum amount that the brain needs, and they can't go back.
Okay.
And so I think it tends to be like this kind of these jumps that happen as it slowly goes.
Because I mean, there are people that I know and patients that we have who's exactly as you say, they were sleeping a certain amount of time and then they have some acute illness or they become ill or something disturbs their pattern. Maybe they get admitted to the hospital, into ICU and so forth. And they'll tell you, since I was in ICU, I don't sleep like I used to. I sleep much less, so I sleep at different times of my pattern, and I can't fix it up. Look, we're going to get back to that as soon as we get through with this ad break, but there's some really interesting things, and it's just a pity we couldn't get more people calling in and taking part in the conversation. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health Matters, a comprehensive chat with the Islamic Medical Association. We're talking sleep today. We're not sleep talking, but we're talking sleep with Dr. Alison Bentley, and we've already had some really interesting bits of information, and there's much more to come, I can tell you. So let's just get back to where we were. We were talking about the quantity of sleep and how it varies in different ages, and we were discussing in the break, does it matter when you sleep, whether you sleep at night or if you catch a couple of hours in the mid-morning or in the mid-afternoon? Or
well, it does, and actually when you sleep is controlled by your genes as well. So people genetically are either more a lark or an owl. And so the owls are me. I'm an owl, and so I would much rather stay up until 1 o'clock in the morning. So if I have to study or do anything, like much rather stay up until 1 o'clock, drag myself out of bed before 6:30 in the morning. Okay. The larks are the people who traditionally we would think of as the farming kind of
they wake up
sleep
with
patterns.
the first crack of dawn.
Yeah, so they're in bed at 8:30, and they're up at 4, 5 in the morning. So most people sit in the middle. They're not that. Those are the two extremes. Most people will sit in the middle. And actually, there's a very biological process that times our sleep, and that's the light and dark. So.
That's controlled through your pituitary and pineal
yes,
gland.
And through melatonin. So basically, we produce melatonin during the day, but because light enters our eyes, it's not secreted.
Off, yes.
And as soon as it gets dark, melatonin gets secreted, and then it comes out in a rush when it starts.
Now, I mean, obviously this genetic programming has occurred over several thousand years, presumably, and it's only in the last 100 years that we've got bright lights in the middle of the night, like these lights that are shining in our eyes right now. So how does that affect the sleep patterns and the genetic predispositions to sleep?
Well, it does interfere with the genetic predispositions if you're a lark, right? Because no matter how much light there is, it's not going to help. But what the light does do is the amount of light we're exposed to in the evening does prevent the melatonin from being produced.
So melatonin is a sleep trigger.
It is, because what it does when melatonin's produced, it actually drops up the body temperature by nearly a degree.
Yes.
So quite a significant drop, and it's as your body temperature is dropping is when you feel sleepy.
Yes.
So you kind of got to catch that wave, right? Once the body temperature has dropped low, it's actually harder to fall asleep. So it's hard to fall asleep when the temperature's high, marginally easier when its temperature's low, but it's that drop that you need to catch. And so if you're exposed to a lot of light at night, then the melatonin's not produced, and that drop in body temperature is delayed. And that's what we would call the delayed sleep phase syndrome. And in young men particularly, they push it out quite far, and then it's difficult to come back.
Well, obviously they're watching TV, or they're sitting with their cell phones and iPads and on the computer.
Well, that's the problem. It's anything that's backlit. So it does include cell phones, not the old cell phones that had this bigger screen. You know, they had this tiny little screen.
Smartphones really.
The smartphones are big. The iPads, the laptops, anything that is backlit. So, for example, reading a book with paper is fine because it's not backlit. Kindles are fine because they're not backlit. You still need the light coming from. So those are not as destructive to the sleep. But yes, you can push. It's very easy to push your sleep further and further away from you. Much harder to bring it back. So we do find that young men tend to push it out and then can't pull it back again.
But say you're an older person and you're now using an iPad to read or something like that, and your sleep is delayed. Does that mean that you're going to wake up later, or does that mean that you'll wake up at the time you were usually meant to wake up, but you'll just feel tired during the day?
Usually, if it's just moving the sleep as a jet lag kind of thing, what happens is that you wake up later as well. So it just takes, let's say it's 7 hours of sleep. Instead of being 11 to 6, it's now 2 to 8 or 2 to 9.
So obviously it's not possible if your routine in your life demands that you must wake up at 6 or 7 o'clock, because then you're forcing yourself awake with an alarm.
Well, that's the problem. And so they do wake up early, but they still can't get to bed early the next night because that body temperature is still going to take still a couple of hours later. And you end up with a sleep deficit. Well, you end up, quite a significant sleep deficit, and particularly if you're in matric or at varsity, or you're trying to study it becomes very, very hard to actually do that.
How does that sleep deficit, this is very important for people who are trying to study, and it's quite a common phenomenon in people in school and throughout the university life. And I know we battled with this amongst myself and my friends, and I know that the use of caffeine to keep you awake and alert during exam periods is quite a common phenomenon. And I think it's partly because of these sleep disturbances and these abnormalities in your sleep that you don't have that alertness and that concentration. How does it affect that ability to concentrate?
It's hugely important, because if you don't sleep, you are the first kind of deficits that we find are not feeling sleepy. That actually is quite a way away. But the first deficits are what we call our executive functions, which are our frontal lobe right there in the front. And it's about understanding risks, understanding consequences of actions.
It's almost like being drunk.
It's very similar to being drunk. And so when you look at those videos on YouTube with the guy on the roof with his skateboard, and you just look at it, you go, this is not going to end well. You just know it's not going to end well. That kind of sense of, I'm sure I can do this, and it won't be that bad, and that kind of thing. You get that with sleep deprivation as well. But the important thing is memory and sleep are very closely linked. So we have good evidence now that even if you study and you sleep, that actually that's when you put those memories into long-term memory. During sleep. So during wake you kind of put them in, but you have to be asleep to really encode them and
fix them in your memory.
To fix them in long-term memory.
Right.
So if you reduce the amount that you sleep, then you're reducing the time that the brain has to put those memories in.
Yes. I mean, interestingly, I mean, there are people who learn the Quran by heart. They call Hafiz and Hufaz. And if you speak to the teachers and those ustads who teach these young children, they will tell them that their sleep is critically important. And also, they often will study early in the morning after they've had a good night's sleep, and their minds are fresh and their concentration is good to be able to internalize them. And they'll often rehash it or repeat it or revise it later on in the day so that it sticks into their memory. You know?
Well, memory is very much like a river, which often starts on a very flat surface like this, but every time that river flows down there, it's kind of grooving the surface until
so repetition is important.
Absolutely. So the repetition is there, and that kind of grooving happens during sleep.
But attention and concentration is very important.
Well, otherwise you can't put it in.
Yes,
you see,
absolutely.
so that there are these two components, and if you're very sleepy during the day, you can't put the memories, you can't actually engage, put it in, and then the sleep. But I mean, even a sleep of half an hour is useful to kind of the memory. There's evidence that your memorizing of something is better after just half an hour of sleep.
There is some evidence, you know, that has been doing the rounds, that a short afternoon nap, and I think the amount they put on is like 25, 26 minutes, can improve your function in the remainder of the day.
Yeah, but also that is kind of genetically coded.
Right.
So you'll find that, and when I do talks on sleep to groups of people, I'll say, how many of you can power nap? So that's what we call kind of a 15, 20-minute nap.
Yes, yes.
And how many of you can power nap? And it's a significant minority that can do it.
Can it be learned?
Well, people, if you speak to men of a certain age, kind of in their 50s, they will go, once you've been in the army, you can power nap, okay? So, and as interns, I think we also, after we've done interns, we kind of sleep anywhere, anyhow, because we're so short of sleep.
Absolutely, yes.
So I think there is a sense that if you're in those very stressful situations, that you can learn to do it.
Right.
But most people can't do it.
Yes.
And for me, if I want to have a nap during the day, it takes me ages to fall asleep. I wake up feeling drunk. It takes me another half an hour. I go, that was a waste of time, because I don't feel better afterwards.
What the evidence said is exactly what you said, that if you sleep a bit too long, it impacts your functioning, because then you have to wake up completely from that deep sleep. But if you sleep just the right amount for you.
And also if you sleep for an hour or more than an hour, you've got to think about the fact that that gets taken off your night sleep.
Sure, absolutely.
So you can't sleep for 2 hours in the afternoon and another 8 hours at night.
Yes, because obviously your body has had its share of sleep for the day.
Yeah, well, because we spoke about the one thing that gets you to sleep is your drop in body temperature.
Right.
The other thing that gets you sleepy or feeling sleepy so that you're ready to go to sleep is being awake for long enough.
Yes, yes.
It's like a credit card. You got to spend on this credit card until the bank's phoning you and saying, you've got to cut this up.
You've reached your minimum payment balance.
You've reached your maximum and you have to pay it off by sleeping.
No, absolutely. I mean, we didn't really go into great detail about it, but we did touch on it, and we'll get back to it. Obviously, there are drugs and other techniques which you can use to assist your sleep. So you mentioned melatonin, and there may be other things, but often those are reserved for patients with specific sleep abnormalities and sleep disorders. And that's what we will get to after this next ad break.
We've done the lead-in program.
And Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat with the Islamic Medical Association. We're back with Dr. Alison Bentley, and we were discussing, we discussed quite a lot of stuff about sleep and normal sleep and quantity of sleep. Let's get to the problems with sleep. What's the commonest thing that people come to you and say, Alison, is it I can't sleep, or I sleep too much?
Oh, insomnia. I can't get enough sleep is by far the commonest sleep disorder. Right. We don't know what the numbers are in South Africa, but overseas it's about 10% of the population will have chronic insomnia. Yeah, and a lot more have acute insomnia, which would just be for a week or so, a couple of days. A lot more have that. Okay.
And that's commonly related to life circumstances, stress.
Oh, it's all kinds of things.
Something happening, it's acute illness.
Yeah, so it ranges from acute illness, acute stress, So you get it during exams, for example, if you're going through a stressful period like a divorce or a death in the family, you'll get it. With medical illnesses, you'll get it. Pain is a big one. Noises. Every mother who has a small child pretty much has an insomnia imposed by the child. But then if you look at the kind of real medical causes of insomnia, I mean, we have restless leg syndrome, which often causes insomnia. So very uncomfortable feeling you have in your legs at night, where you have to move your legs to get them comfortable. Often, as you can understand, is going to interfere with your ability to fall asleep.
Yes, because you're anxious about these legs having to move all the time.
Depression, so clinical depression. 70% of patients with clinical depression will have an insomnia associated with the depression, caused by the depression.
So it's one of the what we call neurovegetative symptoms.
It's a symptom of depression.
It's an objective symptom.
It's worse than that now, because we now have good evidence that if you have insomnia from any cause,
worsens the depression.
No, it causes increases your risk for depression pretty much for the rest of your life.
Yeah, I'm not surprised, because if you don't sleep, you're not happy.
No, and so you certainly do have depressive symptoms. You feel miserable and you're moody and you have all of those. You don't want to do anything and you just want to go to bed and stay there. So you do have those kind of symptoms, but the risk of full clinical depression, where you would need medication and treatment for that, is increased as well. But the commonest cause of insomnia is a little voice in your head that when you're trying to go to bed goes, I don't think you're going to fall asleep, I think you're going to battle to fall asleep because you battled last night, and what if you... And people will say they're not anxious about anything. They don't have financial anxieties. They don't have family anxieties.
But they're anxious about sleep.
They're hugely anxious about sleep.
Yes.
And so as night falls, they're starting to think, oh my goodness, I'm going to have to fall asleep.
Yes.
And that anxiety
Am I going to
builds.
fall asleep before they even get to the bed?
By the time they get to bed, it's very much like performance anxiety with other things like impotence and that kind of thing, is that the more you worry about it, the harder it gets to do.
It becomes a self-fulfilling prophecy.
Well, and I mean, understand that falling asleep is not hard, right?
Yes.
You just have to lie there, be sleepy. You need to be sleepy. Then you need to shut your eyes, lie down, and just let go.
Yes.
But if you're anxious, you can't let go.
Well, I think what people say is that, it's difficult as an individual to define that moment when you're awake, when it melds into that moment when you're asleep.
Yeah.
The mechanics of sleep is sort of beyond your control at that individual level. You have to put yourself in those circumstances.
And just let the body do it, the brain do it. Yes.
Let the brain do it.
Yeah.
But when you interfere with that process by becoming anxious about it, and I mean, the times I've suffered insomnia.
We all have.
And the times when I've suffered insomnia was at the times when I most needed to sleep, and I felt in my mind I must sleep early today because I've got something important happening tomorrow. So before a big exam or something else, and then you get to bed and say, I'm going to be in bed, I'm going to sleep well tonight, and then you can't sleep because you're thinking, it's now, what's the time? I still haven't fallen asleep. That's 1 hour I've lost, and you look again, and that's 2 hours I've lost. So as you yourself interfere with those mechanics.
I usually say that if you ever go to bed and you say, I have to fall asleep now because you're done. It's not going to happen. Yes.
Now, I mean, I speak to quite a lot of guys who run the Comrades Marathon.
Yeah.
And the majority of them will say that you should sleep during the week before the Comrades because the night before the Comrades you're so anxious and worried about getting that sleep that you don't sleep.
And also you have to wake up really early to get to the race and all of that kind of thing. And very often, as I've said, it's much easier for us to go to bed later than it is to go to bed earlier.
Yes.
For all the reasons that we've described.
Yes.
So that kind of sense of that self-fulfilling prophecy of insomnia is probably the single biggest cause of insomnia.
Right.
Even it might have been caused by something else, but it's kind
maybe
of taken.
Off by something else, triggered off by some event in your life or some medical illness or something,
and it doesn't happen in everybody, but in a group of people, they kind of move from, well, I know why I wasn't sleeping there, but I hope I sleep tonight. This is kind of gone.
So let's get into the nitty-gritty. How do you deal with that?
Well, primarily we deal with that by saying, what we need to do is get your confidence back about falling asleep.
Right.
And so
you need a few good nights under your belt.
You do, but you kind of got to really push it to get those.
Right.
So generally most people around the world would do the same 3 kind of processes.
Right.
Firstly is sleep restriction, and that is generally if you have trouble sleeping, people spend more time in bed.
Right.
Okay, that's not helping.
So they spend time in bed looking at the ceiling. They
so
can identify
they were
every
spending,
spot on
yeah,
the
they were
ceiling,
spending an hour in bed awake, and now they're spending 3 hours in bed awake because they've added 2 hours. So sleep restriction means you crunch your sleep up really down to 5 or 6 hours.
So you must get them out of bed.
Oh, they don't go to bed.
Okay.
And they could be horrified when I said you go to bed at midnight, get up at 5, or else you can go to bed at 1, get up at 6.
Right.
Crunch it down quite a bit.
Right.
Keep a diary of your sleep, because I think once you start having sleep problems, every night is a disaster and every night is awful, and they're not.
And then you don't remember the
you
nights
don't remember
when
the
you
good
had
nights.
sleep.
Yes,
Right.
you kind of just think that they're just incidental.
Right.
So they take a sleep diary, and then the last component of it is if you go to bed and you can't fall asleep within about 15 minutes, get out of bed, because now you're in trouble. And if you lie in bed, the thoughts that you have at that time, understand
Become
what you've done.
counterproductive.
Well, they're counterproductive, they're bleak, they're very destructive, they're catastrophizing, they're ruminating, so we think about the same thing over and over and over and over again. So get out of bed. It's an extreme version of counting sheep. Okay, distract you from thinking about sleep.
Right.
Get out of bed until you feel sleepy again. It's about half an hour, 3/4 of an hour. Then you can go back to bed.
Okay.
And I find that if you do that over a period of a week or so, that your sleep significantly improves.
Improves.
Yeah.
And is there anything specific you can do or you can't do when you're out of bed? Should you exercise? Can you go and have a cup of coffee?
No, that'll keep you awake. So no caffeine and no exercise.
Right.
And what's interesting is people will always say to me, but what should I do? Like, what can I do? And I go, you can do anything you like as long as you don't drink caffeine and exercise. So you can read, again, not with a backlit screen.
Right.
So read a book. You can clean cupboards. And very often I've got nothing to do. And I will say, go and find a cupboard that's not clean and go and clean it out.
Right.
Go do your photos, like look through photos. All those jobs that you don't have time to do.
From an Islamic perspective, it's pretty simple. If you can't sleep, you can pray.
Yeah, exactly.
So you can take the Quran, read the Quran, study the Quran, or perform nafil prayer, make zikr, those type of things which are meditative and will obviously relax you. And I do find that does help. If you do those types of activities, after a little while you will feel a bit sleepier, and then often you just switch off the lights, get into bed, and you'll be sleeping within moments.
Yeah. And again, it's just about distracting your thought processes from worrying about sleep.
So you're not anxious about the sleep.
Yeah.
And also, what I find good about doing things like that is it's productive.
Yeah.
So you may feel, I'm not going to sleep now and I'm going to be so tired tomorrow morning. Maybe what you need to do is say, look, let me see, what do I need to do tomorrow morning? Tomorrow morning I need to get my clothes ready. I need to do this and this. So you can do some of those things in the evening. Maybe you have some homework or some paperwork you need to do the next day. You can do them, catch up with that at night.
Absolutely.
And then some of that work is done, and you can wake up a little later in the morning if you haven't had
even if you don't, even
sleep.
if you spend an hour up at night and you're an hour short of sleep, making it a productive hour is much better than sitting there and having dramas about the fact that you're not sleeping.
Yes.
And the worst that happens the next day is, yes, you are a little bit sleepy and you're a little bit down on that.
But you may sleep better that night.
But you should sleep better that next night, yes. So plan on adding that hour on the next night and you generally will sleep better.
Are there any things in our lifestyle which will impact on sleep or make that type of insomnia worse, like diet or
Not really diet. I mean, there's not much in the diet. I mean, I think you kind of need to be careful about caffeine because it's in all kinds of things like bread and all kinds of odd things. So you do need to be careful about that. And obviously the major thing with diet is indigestion. So you can't...
So obviously if you've got a specific problem with obstructive reflux or you have asthma or something like that, you may need to make sure your medication is controlled.
Exactly.
And those
that's
type
important.
of things are looked after.
But general other lifestyle things, diet and what you drink and...
Smoking?
No. Smoking, not necessarily, unless you. I mean, what happened when they brought in all the restrictions of smoking in buildings is that people would not smoke during the day at work and come home and finish like 20 cigarettes.
Chain smoke, yes.
So that's a problem because then there's a chunk of nicotine and that'll keep you awake.
Right.
But generally, no.
Right.
No.
Well, I find one of the things which initiates insomnia in some people is obviously stopping smoking. because they develop nicotine withdrawal, and some people look at that as an obstacle to stopping smoking. They won't stop smoking because they can't sleep and their dietary exercise is obviously there are some circumstances during which it may be appropriate to use medication.
Oh yeah, I think there are times when it is appropriate, but I think what's not appropriate is giving patients 30 tablets and every month just giving them 30 tablets with no kind of sense of let's see if we can fix this.
Right.
Particularly if the tablets aren't working and they're trying different tablets. I mean, as you know, there are sleeping tablets that are designed and they really work extremely well.
Yes, yes.
But because everybody's so worried about becoming dependent on them that we end up using antipsychotics and antidepressants and antihistamines and all kinds of other drugs which don't work well, which don't work as well as the hypnotics do. But that's because generally if you understand how sleep works, you can get away without them at all, completely.
Do you ever give patients a rescue sleep medication? You tell them if you haven't fallen asleep by this time, you're allowed to take the medication?
So usually when I'm treating insomniacs and I tell them to do those 3 things, I usually will give them a sleeping tablet every 3rd night on script.
Right.
Because you shouldn't wait until you're desperate. Because if you're desperate, you spend 2 or 3 nights going completely crazy.
And then you're just going to go more crazy.
So I say take it every 3rd night, because then you've got 2 nights in between where you're doing it without. Yes. Right. But you're either the night after a good night's sleep or the night before a good night. So the pressure's off. Right. Which actually helps you fall asleep. Yeah.
And so, I mean, if you have a good night's sleep, you can delay that tablet for an extra night.
Yeah, and the point
you
is
have the confidence to do that.
And if you're taking it every 3rd night or every 4th night, you can't get dependent on that. So the whole deal is different.
Right.
And you can do that for months and years while your sleep is gradually coming back.
Yes, yes. Does ambient light affect your sleep quality or your quantity or your ability to fall asleep?
Not really, no. I mean, you know, people will tell you, I can't sleep unless it's pitch dark, or it's got to be, I've got to be flat, or it's got to be like this. So people will have routines and rituals about falling asleep, which is specific to them. Right, right. And that's in fact, doing that is part of your good sleep routine.
Yes.
So very often,
sleep hygiene.
Yeah, the sleep. So very often people, but when they go to bed, won't feel sleepy. Right. But by the time they've changed in the pajamas, brushed their teeth, fixed their glasses or taken their lenses out, read the same 4 pages of the book.
They've told their brain it's going to be time to sleep.
Read the same 4 pages that they read last night. By then they're so sleepy they can't stay awake. Yes. And so in good sleepers, all of those things are a good thing. Yes. In insomniacs, all of those increase the anxiety
as time goes on. Yes.
Well, you see, now I've brushed my teeth and I'm still not sleepy, and I've done this and I'm still not sleepy, and I've done this. So
they can be productive, or
they can be counterproductive.
So I mean, I think that's where, if you're doing these rituals and they're not working, doesn't mean you've read the dua before sleeping, you've read the kalimas, and you've read all your ayahs from the Quran, and you're not sleeping, that you must go and sleep now. You can get up and go out, and you can come back and do that ritual at some later stage when you feel sleepy. And I think that's important because that anxiety actually becomes counterproductive.
Oh no, it does keep you awake.
And keeps you awake. The sleep disorder associated with depression. Are there any things which will give you a clue that this is related to depression rather than...
Yeah, the typical sleep disorder that we get with depression is an insomnia. Right. But patients usually find it quite easy to go to sleep. They usually wake up about 1 o'clock in the morning and then really battle to get back to sleep.
So so-called terminal insomnia.
Middle insomnia. That would be middle insomnia. Right. Those are the terminal insomnia is when you wake up at 3.
Right.
Okay. Right. And you plan your sleep till 6. Okay. And the terminal insomnia, for me, the patients that I find normally get it are people who have really chronic stress and high stress loads. Okay. So I've seen it in people whose companies are listing on the stock exchange, and there's this whole process they're going through, and it's just so stressful.
Do you think it's related to the cortisol spike in the early morning? Do they have a high amount of cortisol?
I don't know. I don't know that, but I do know that if I start waking up at 4 o'clock in the morning, that's my burnout call, right? No, it really is. And a number of people have said that, they said when they're really pushing it and they're doing way too much, even if it's just a transient thing, like just for a couple of days, I know that when I start waking up at 4 o'clock, I go, right, I need to take some stuff out of my life because I'm doing too much.
All right, we're going to go to the next ad break. This has really been interesting. I'm even forgetting to call for the ad breaks, but we're going for the next ad break, and then inshallah when we come back, we'll try and wrap up. There's just so much more we could discuss, but we'll try and wrap up and see how much more information we can squeeze out of Dr. Bentley. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. We've been discussing sleep medicine and problems related to sleep with Dr. Alison Bentley, and it's really been very entertaining. We're coming towards the end of the show, but there's still a lot of information that we need, Alison, and we haven't really even gone into some of the bigger aspects of sleep medicine. We had a show a couple of weeks back where we discussed some aspects of obstructive sleep apnea. Just give me your take on obstructive sleep apnea, how common it is, and some of the problems that it causes and that it's related to.
Okay, so I think sleep apnea is a lot commoner than we think. Right. Certainly, the combination of snoring with these interruptions in breathing and the gasping and starting to breathe again. The evidence that we have, again, only from international literature, would say that about 10% of men over the age of 40 have sleep apnea.
So I could be 1 in 10.
You could be. And in women, it's less than that until they go through menopause. So it's over the age of 40 where it kind of starts increasing. Women over the age of 50 starts increasing. And the important thing to recognize is that it is an obstruction to airflow. You are unable to breathe in the middle of the night. The throat closes in, gets sucked in on itself. And you're not able to move air, and so the brain literally has to wake you up, otherwise you're going to die.
It's got to panic. It's got to save itself.
And that panic saves you in the middle of the night over and over and over again, but unfortunately has a whole lot of repercussions in the body because it's happening 100 times a night, for example. So
the important thing is that you may not be conscious of this panic occurring. Very
often you're not. So even people who have severe sleep apnea will say, I wake up 2 or 3 times a night. And I go, no, actually you wake up about 120 times a night. So there's a big disconnect with how many times you think you're waking. And that's because you wake for a couple of seconds and go back to sleep. And we have good evidence that you don't remember wake-ups unless they're at least 2 minutes long.
Right. So you may be waking up for a few seconds, which is enough for you to breathe again.
Yes.
But not enough for you to remember.
Go back to sleep. And the thing is, you know the next morning, because the cardinal symptom with sleep apnea is you wake up in the morning feeling exhausted.
Like you haven't slept.
Like you haven't slept.
So even though your watch tells you fell asleep at 10 o'clock and you woke up at 7 o'clock.
Yep.
Your body tells you that you really didn't sleep very well.
And you're sleepy during the day, so you are aware that you're tired during the day. So there's a complete, unlike insomnia where you're very aware you haven't had enough hours.
Right.
Here you have had enough hours, but you're still falling asleep during the day and feeling sleepy and tired and that kind of thing.
So it's a problem with the quality of sleep.
It's a quality of sleep issue. That's exactly what it is. And that's the other big group of sleep disorders. So the one group is the quantity and the other group is the quality.
Right.
And there are a number of things that can affect the quality, but not as many as you think. I mean, it's pretty much sleep apnea and snoring, a kind of a breathing issue or a leg issue. So the legs move, and in children particularly we can have epilepsy during the night that creates a poor quality of sleep. But that's really the big 3 that we would look for.
The other things like shortness of breath or pain or medical causes usually will affect the quantity of sleep. You'd be aware of those. So you would be awake usually during those.
And we don't really know what a low-grade pain would do to whether it affects the quality of sleep or the quantity. So we don't really have good evidence or good experimental evidence for that kind of stuff.
What are the risk factors for sleep apnea?
Well, the risk factors are really summarized by the acronym STOP BANG. Okay. And so the S is for snoring, the T is for tiredness, O is for observed apnea. So somebody's seen you stop breathing at night.
Okay, and often usually that will be your spouse or partner or
the P is
co-worker or somebody.
The P is for pressure, and that's high blood pressure. So if you have high blood pressure. Then the BANG is BMI, obesity. Okay. The A is age, over the age of 40 or 50. The G is gender, if you're male, you're in trouble. And what is it, BAN? I've missed out one. N is neck circumference, and that is if you've got a thick neck. So the neck of 43 centimeters or over.
So look at me, I'm counting the risk factors.
So those are the risk factors. They're the easiest ones to remember is as STOP BANG.
And the G you said was gender.
So if you're male.
Yes,
so more likely.
If you do have those risk factors and you feel tired and you're not sleeping well, how do you diagnose this condition? What happens?
Well, really, you have to go into a sleep lab because obviously you don't know what's happening. And the important thing is to know how bad it is, because the more severe it is, the more radical the therapy we have to.
I mean, that's part of the problem we have, is convincing patients that this is really a real condition. It's not something that doctors have made up just to make more money. It really is something which does exist and has been shown to have negative consequences. It's just that it's not as easy to diagnose perhaps as high blood pressure. And if you can imagine 200 years ago, high blood pressure was a foreign concept.
Yeah.
And it was a concept, if you told somebody that the pressure of your blood in your blood vessels may be causing issues and may be causing you to have heart disease and strokes, it really was a foreign concept. And it's only over the past sort of 25 years or so that obstructive sleep apnea as a concept has emerged and has become a prominent and more understood condition.
And I think we're also linking it to more and more repercussions of that panic that's happening multiple times at night. So we now know that sleep apnea is the #1 secondary cause of hypertension.
Right.
So high blood pressure and everything that does, the heart attacks, the strokes, everything that's related to that. We now know that it's related to diabetes. So that it increases the risk of diabetes. So if you're obese, you can have diabetes anyway, but if you're obese and you have sleep apnea, then there's a much higher risk.
And it may be related to the hormonal changes that occur.
Oh, it is. It does change the insulin, glucagon, leptin, ghrelin, all of those kind of hormones. It also makes it much harder to lose weight. So if you have sleep apnea and you're obese, because of those changes in hormones, it's really hard to lose weight.
Is it specific for sleep apnea, or would you say that insufficient sleep in general impacts your hormonal milieu in a way which affects your appetite and your metabolism?
We have really good evidence now, particularly in adolescents, that the adolescents who are overweight are much more likely to sleep less.
Right.
So to restrict their sleep.
Abnormalities.
So there's good evidence now that a reduction in your sleep, whether it's caused by sleep apnea or whether it's caused by a deliberate restriction of hours, increases your risk of being overweight.
Okay, I mean that's fascinating, and I mean really everything we've discussed today is fascinating. Unfortunately, we've run out of time,
as always,
and you know, we could carry on, and I'm sure Alison could continue talking until I fell asleep. Although what she's saying is pretty interesting. You know, let me tell you a story. As a group of students, we once had a lecture by an anaesthetist. And when we walked out, one of my friends told me that guy is an excellent anaesthetist. And I said, how do you know that? We just gave us one lecture. He said, no. From the moment he started talking, I was out. So he put you out without even using any drugs.
I find that when I talk about sleep to audiences, they all start to yawn because it's difficult not to.
The power of suggestion. Well, thank you very much, Alison. That was really very useful. And Jazakallah khair, thank you for all the audience for listening. It's unfortunate that we couldn't have full audience participation today, but inshallah, as time goes on, I hope to repeat this topic, and inshallah, we'll then be able to take your calls. As usual, I'd like to wish all those who are suffering, those who are ill, those who have problems with their medical or otherwise, that they get relief, that Allah subhanahu wa ta'ala helps them, gives them shifa, gives them relief, and we pray that Allah grants the entire world peace and harmony and unity, and we pray for our country, we pray for all those around us, that Allah subhanahu wa ta'ala helps them in everything they need. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.